I would like to welcome all of you today. This is actually the 8th progress report, the last one, what the students need to finish in order to receive a PhD. The first 4 PhD defense is in year 1, 2 in year 2, and after the home defense and the final defense. So let's a little bit summarize why we are here and what is the road we could successfully go through with the students. Our vision is very, very clear, from science to society. And the question is, what does it mean? How we can bring science into healthcare? We always believe that if we would like to change something, we have to start at the beginning, which means, of course, the education. So what is translational medicine about? This is a key question. This is the earliest model, which came from the NIH, which from the bed to the bedside or back from bench to the bedside. However, later on, scientists realized that this is not the most effective way because the 2 parts speak different languages. Therefore, they established another model which started at T0 from the idea and going through to T4. However, the biggest problem with it that this is also lots of occasion slow process, and sometimes it's 15 years or 17 years to get something discovered in science for patients' benefit. Therefore, at Academia of Europea, which is the largest academy in Europe, having more than 5,000 members and 93 Nobel laureates, felt that we need to change the system a little bit. And what is this changed about? That the whole process needs to start at healthcare when you are at the bedside. You ask the question at the bedside, how the disease develop, how we need to treat this disease. And whenever you have the idea, you do scientific activity, respectively it's basic or clinical science, you summarize the knowledge, but highly importantly, you communicate and apply back to healthcare. So we discovered this cycle model in 2020, and I am really, really very happy that the top journals in medicine in the last 4 years accepted 3 articles from this work group. First of all, writing down about how effective it, after this educational method, how to train the next generation of scientists, and this is just accepted in 2 days ago, which actually describe how to help policymakers to translate the scientific results for daily application, which means that everything has safety, effectiveness, and cost. If all the 3 rings are green, it should be immediately applied. If all the 3 are red, it should be immediately abandoned. And of course, there are plenty of things in the middle, but this also can help to translate scientific knowledge to patients' benefits. Although it's a doctoral program, this is not about PhD, although we are at the defense. This is answering clinical questions. And what is really the best example for that, which actually happened over 150 years ago, that a scientist or a physician, I would say so, even physician, stood next to the bedside and asked the very simple question, why is the maternal mortality rate significantly higher in one of the clinic than to the other clinic? And what he did, he asked an important question, collected data from the 2 units. You can see the high mortality rate in the one clinic, you can see the other mortality rate, did an analysis and find out, had a hypothesis that this could be due to the fact that people doing autopsy directly go to the women examination and bring this, and the name was Semmelweis. He asked a very simple question, data collection, data analysis, went back and applied it on the next day. And this can be done in different things, even at hospital level. For example, one of the students in Székesfehérvár came when the study started in Pécs and asked the simple question, why we use 80% of antibiotics in acute pancreatitis, which is not an infectional disease. And he immediately understands that the reason is misunderstanding the basic inflammatory markers, the CRP leukocyte level, changed it, went back to her own hospital, started applying. Within a single year, she could decrease the usage of antibiotic with 31% and the length of hospital stay with 1 day. Third year, she defended her PhD. Another example, like in surgery, an otorhinopharyngologist at Bajcsy Hospital asked a very simple question: which surgical technique is most effective in minimizing the recurrence rate in cholesteatoma? And they did a data analysis. They published it and found out that the mastoid obliteration is the best model for that. And they not only published it, next year she immediately started using, and within a single year they could reduce it with 13%. And the third year she defended the PhD. So if somebody asks, what is it about translational medicine and this program? To make the doctors more effective. So this is not only help, of course, to the patient, but this helps also the universities, the doctoral school, to fulfill with the program of the doctoral education. This program started at the University of Pécs, 2019. The first 37 students, they are already graduated, started there, and after that, to do it in a higher scale, it moved to Semmelweis University, and currently we have 440 PhD students in the program. And if I look at that, not only the patients get benefits, but if I look at the journals where our students could publish, and we read these journals, I think at every university level, all administrative leaders would be proud of having these kind of publications. If I summarize in numbers, of course, number doesn't mean too much. The individual examples bring too much. But if I look at the numbers, that the average impact factor of the papers is around 5, the center already published over 400 articles, then these numbers are really strong. And we are very happy because the Hungarian government in June also realized that they have to change the medical training for physicians. And from the first year, from September, the program is supported by the health administration, and the deputy has the state secretary. They put it to the laws that from September there is a hybrid education for residency and PhD program officially supported by the government. And if we put the two parts together, even the doctors will earn the same amount of money they would earn if they do the residency. So this program is now currently in action. So we hope that from September, other universities and other parts will join as well. The program is always supported by key figures in science, which coming to this program also to give presentation, and also coming to the high school education program we're organizing every year in Szeged, which we started in 2012. And I have to announce the breaking news in the Szeged program. There are 4,000 high school students registered for a scientific event will be held in a handball arena, because we cannot keep it any longer at university lecture hall. So in 24th of November, Peter Radcliffe from the University of Oxford and Sharok Shariat from MedUni Vienna will come over, and we already have the March speaker as well. But how the whole program's going, we have a very short video what I would like to show you before we start the whole process.
Science is an indispensable element of progress and the future. Science changes lives when discovery leads to action. The National Academy of Scientist Education makes this happen through two programs. the Discovery Science program, which focuses on nurturing future researchers, and the Translational Science program, which turns knowledge into real-world applications.
I think the development is fantastic. When I came first time, it was a program centered in Szeged, you know, with students coming from different parts of Hungary. But meanwhile, the program has developed into two branches, you know, and actually one of these branches aims at revolutionizing science education in all of Hungary.
I don't think you can be a good physician today without understanding science, without doing science at some time in your life, asking questions, critical questions, analyzing the literature.
The Translational Medicine Hybrid PhD program, launched in 2016, aims to provide healthcare professionals with the knowledge essential to translate scientific results to their patients' benefits. Since 2019, 50 students, including doctors, dietitians, psychologists, and economists, have defended their PhD theses as part of the program. To date, more than 350 PhD students and 200 mentors from 24 countries have joined the international program. Recently, the program has accelerated significantly with the support of Semmelweis University, the government of Hungary, and Academia Europaea. Healthcare professionals have been able to demonstrably improve the quality of patient care in a short time, which, in addition to its positive social impact, has also resulted in cost-effective patient care.
If they choose to develop career in science, they will have the view of the entire distance between the patient bed and the route to try and cure and help and develop drugs like we do.
Besides the several professional and social events, students of secondary schools and universities, as well as healthcare professionals, can attend the meetings of Nobel laureates and talented students, which are organized by the Academy twice a year. At the conferences, approximately 2,000 guests, pupils, students, mentors, doctors, and other faculty members can listen to scientific presentations of professional quality, participate in educational events, and meet or talk to Nobel Prize-winning scientists and internationally renowned researchers. Since the first meeting in 2012, the Academy has held 24 successful conferences, with the prestigious participation of 18 Nobel laureates hailing from different parts of the world.
First of all, I have a tremendous admiration and inspiration by what is done here to this program. This program is unique around the world. It's very special. It's not only going to improve Hungary, it's going to improve not only Central Europe, it's going to be a motor for progress, innovation, and a better world around the world.
The capital that you are building through this program, human capital, social capital, and potential economic capital, this is a great investment, and I really think that every country should have programs like this, and I think that you should invest as much as you can afford it.
Péter Hegyi convinced me that it's a good idea to train young people of the area of Szeged, and knowing Péter Hegyi, I know that he's a very hard worker, very enthusiastic, and I just got infected by his enthusiasm. All I can say is I'm very impressed, and I hope it continues like this.
And now I think at that moment, I think I'm stopping. Welcome everybody and enjoy the 8th progress report of the students.